You are tuning into the Aged Care Nursing Journey podcast with me, Anh Do, your founder and host. In these podcast episodes, I share my clinical and operational experience to help you understand the Australian aged care system and provide practical insights into the sector. More importantly, my goal is to empower, inspire, and guide your professional growth right here in Australia's aged care sector. If you're new, make sure you subscribe and feel free to check out the previous episodes to learn more about my background and journey. So, have you ever wondered how RNs can excel beyond bedside care, or how they lead in areas like funding, quality, outbreak, and training? Well, today's episode 5, is going to pull back the curtain on 4 key RN specialist roles for career success: the Clinical Assessment Coordinator, the Quality Officer, the Clinical Nurse Educator, and the IPC Lead. We'll explore how they collaborate to protect residents, secure funding, and how they can be your stepping stone to becoming a care manager or even a general manager. Let's start with that big question. Am I right in saying we usually picture registered nurses providing direct, hands-on care? However, the influence goes so much further than that. How do they actually shape the systems that ensure our elder receive care that's safe, well-funded, and high quality? Well, that's exactly what we're going to explore today. Alright, before we jump into the really cool specialist roles, we have to talk about where it all begins. Every single one of these advanced pathways is built on the exact same foundation: the experience and the qualifications of a registered nurse. Now, let's get one thing crystal clear. For any of these 4 specialist jobs, you absolutely must have a current registration as an RN with the Australian Health Practitioner Regulation Agency, AHPRA. This is completely non-negotiable. And why is that? Because that registration is your proof of clinical judgment, professional accountability, and legal credibility. You're not just following a script, you're making really high-stakes decisions. These are not entry-level positions. They're what come next. You know, after you've spent a good 2 to 5 years on the floor, really sharpening those core RN skills. These roles take everything you've learned about assessment and leadership and just amplify it. Alright, so with that RN foundation firmly in place, let's dive into these 4 distinct and really powerful roles. This is the heart of today's episode, where we break down how you can specialize to seriously amplify your impact across an entire facility. Let's break down these specialist roles visually. On screen, you'll see a table highlighting 5 key positions that every aged care facility needs under AN ACC rules. Starting with the clinical assessor. Their primary focus is AN ACC assessments, which directly drive RN practice improvements by ensuring accurate care classifications. Next, the AN ACC coordinator. They secure revenue for safe RN ratios, crucial for funding those mandated staffing levels we discussed. Then, quality officer, handling standards and audits that drive overall RN practice improvement across the team. Clinical nurse educator. Focus on training and skill. They build the entire team's capability, including yours if you're advancing. Finally, IPC lead, infection prevention and control, managing outbreaks and safety to protect residents and staff from infection, vital post-COVID mandates. Let's pause here and circle back. These roles tie into funding ratio for safe staffing. Which one sparks your interest? First, let's unpack the clinical assessment coordinator role. This is where your clinical smarts meet the financial health of the facility. Honestly, this RN is basically a clinical detective. They're digging through charts and assessments, searching for that critical evidence that connects a resident's real-world needs directly to the Australian National Aged Care Classification Funding Model. When they successfully argue for a resident to be reclassified because their needs have gone up, they are literally securing the money needed to fund safe staffing level. It's a straight line. Better funding means more nurses on the floor. And that means safer care for everyone. As you can see, the connection is that direct. Next, let's look at the quality officer. I like to think of this RN as the guardian of clinical governance. They use their deep, hands-on understanding of nursing practice to audit what's happening at the bedside and compare it against the really strict, strengthened aged care quality standards. They make sure the care we give is not just good, but compliant and completely defensible. This role is all about turning data into meaningful action. They don't just count the number of falls. They lead the deep dive investigation to figure out why the falls are happening. Their work builds this living record of constant improvement for the facility and provide the hard clinical evidence we need to prove to the Quality Commission that we're providing safe and effective care. Now, we are talking about the Clinical Nurse Educator, CNE. This RN is what I call a force multiplier. Their job is to lift the skills and confidence of the entire clinical team, from a brand new grad who's just starting out to a very experienced carer who needs to learn a new procedure. They are the engine that drives the whole workforce's capability. The work a CNE does directly strengthens resident safety, boosts staff confidence, and underpin the entire clinical governance framework. And they're not just stuck in a classroom. They're out there at the bedside coaching, preceptoring new RNs, and taking findings from the quality officer's audits to turn them into practical, targeted training that solves real-world problems. The last specialist role that we are uncovering is the Infection Prevention and Control Lead, IPC lead. In a place filled with vulnerable people, this RN is the ultimate protector. They're the expert who designs and leads the systems that are designed to keep everyone including residents, staff and visitors, safe from infection. You know, the stakes in this role are just incredibly high. They're constantly doing surveillance, running audits on everything from hand hygiene to PPE, and training staff on critical protocols and procedures. I would like to highlight their most crucial impact, which is leading the outbreak response. When an infection hits, their ability to lead an expert, rapid response in under 24 hours can be the difference between a small, contained event and a tragedy. I'm sure you would agree with me. This role literally saves lives. Alright, so far we've met the individual players, but the real magic happens when you see how they come together. These four roles aren't working in their own little bubbles. They form a powerful, collaborative clinical governance team that really drives the whole facility forward. Let's walk through a quick, real-world scenario so you can see how it all clicks together. Imagine a few residents start needing more complex care. Step 1. The AN ACC coordinator jumps in, gets their documentation updated, and secures a reclassification for more funding. Step 2. The quality officer notices this trend and starts an audit to find the root cause. Step 3. The audit saw a specific skill gap, so the clinical nurse educator creates and delivers targeted training to fix it. And finally, step 4. The IPC lead reviews all the hygiene protocol to make sure this increased care doesn't accidentally introduce any new infection risk. You see, it's a perfect, seamless loop. The result? Safe staffing is secured, potential outbreaks are prevented, and regulatory compliance is achieved. This isn't just theory. When this collaborative team works together like a well-oiled machine, the facility has the money it needs for safe staffing. Potential problems are stopped before they become crises, and the home is always ready for a visit from the Commission. And this is so important with the new strengthened quality standards. All the work this team does provides the tangible hard evidence you need for accreditation. The Educator and IPC leads work directly supports Standard 2, which is all about the workforce. The coordinator and quality officer's work provides solid proof for standards 3 and 5, covering care and clinical services. Truly, their documentation is the absolute backbone of a successful audit. So, you may ask, what does this all mean for you and for your career? Let's pivot for a minute and look at the incredible opportunity that this specialist pathway can open up. Just let this number sink in for a moment. Up to 90% of our facility's entire revenue can come directly from Australian National Aged Care Classification funding. This just shows how massively important that clinical assessment coordinator role is, but it also shows how the entire team's work in preventing clinical problems directly protect the financial viability of the whole organization. Let's link this to the career growth pathway. You start with that strong RN foundation. You get some solid experience, and then you step up into one of these specialist roles. But it doesn't have to stop there. These positions are the perfect training ground, the perfect launchpad for senior leadership roles like care manager or even general manager. And of course, let's talk about the reward. Stepping up into one of these mandated specialist roles usually comes with a pretty significant salary premium. We're talking 20 to 30% more than frontline positions, depending on the salary structure developed by employer/aged acre provider. And that's a direct reflection of the high-level expertise and the huge responsibility these jobs carry. It's a fantastic benefit for advancing your skills. We have unpacked all 4 roles and its responsibilities. Now, let's get really practical. How can you future-proof your career and actually get started on this journey? This last section is all about your next steps. Let's consider this as your action plan. It's pretty straightforward. First, you've got to build that solid foundation with 2 to 3 years of RN experience. Then, if you're drawn to education, a certificate 4 in training and assessment is your key. If the funding side of things sounds interesting, look into a specialized Australian National Aged Care Classification course for Infection Prevention Control IPC lead, a mandatory IPC course or a postgraduate qualification is the gold standard. But honestly, the advice is the same for all these paths. Master your core skill, stay curious, and find a mentor to guide you. If you're interested in these roles but unsure where to start, you contact our team for personalized support and guidance. So, which specialist path will you choose to amplify your impact and shape the future of aged care? That brings us to the end of this episode, episode 5. Thank you so much for joining and supporting the Aged Care Nursing Journey podcast. Help expand our community by liking, sharing, and subscribing on all channels. Let's support each other on this caring journey to reach individual goals successfully. And make this podcast an interactive platform where you ask, I share, we learn. As mentioned in the intro, the next step up to management is the care manager role. And that's exactly what we'll unpack in episode 6. We look forward to welcoming you back. Take care and goodbye for now.